waiting to see a doctor.
Most of the time when we go to a doctor, it's really not 100% emergency.
How nurse practitioners are stepping up to fill in the gap.
It really just increases the access to care to patients in this state.
And what's the difference, if any, in the quality of care?
Plus, trucking nuclear waste to Nevada. Why it's not only that the waste will be stored here, but how it will get here that has people concerned for all of our safety.
And medical marijuana money.
I think it could be a huge revenue source, but we really just don't know.
The surprising cost to not just get a marijuana card, but just how much it is to own a dispensary and what that money could mean to the state.
Now, Nevada's first choice for news. This is 8 News Now at 6.
Thanks for joining us. Chances are at least a few times you've had a hard time getting in to see a doctor. That's because the Valley has fewer doctors than needed to fill the growing number of patients.
Lawmakers are now allowing nurse practitioners to operate their own offices, trying to make it easier to get medical care. Lauren Rosella here with more on the options you now have with all this.
This is actually Nurse Practitioner Week across the state. So in June, Nevada lawmakers made it legal for NPs right here to administer care on their own. We've actually already seen a similar law pass in Arizona. 5 years later, they saw a 52% jump in the number of new NPs. That's nearly 800 more people providing medical care. Nurse practitioners here hope to see the same jump in Nevada.
This busy dad says when his family's sick, he has no problem seeing a nurse practitioner or NP.
And we go there if they can help us, that will be perfect. If we need to see specialists, we can do that after that point.
Nurse practitioners are high-level nurses with master's and doctorate degrees. Susan Van Buge, an NP and professor at UNLV, says they've always worked alongside physicians.
We treat people the same way. We use the same practice guidelines. We use the same standards of care.
Now Nevada lawmakers say NPs can operate on their own, easing crowding in doctors' offices.
It really just increases the access to care to patients in this state.
Nurse practitioners can prescribe medications, order lab tests, and make diagnoses.
But it gives some options that weren't available before.
Dr. Baird Coates with Healthcare Partners Nevada says his physicians use NPs to help with all aspects of medicine. Coates believes their popularity will only grow.
I think nurse practitioners, as they get more experience and more visibility, they continue to grow in their knowledge and comfort level with handling care.
And for people struggling to see a physician, the option of a practitioner is a welcome relief.
As long as they're, they're licensed and they went to school for that, and there should be limitations to what they can do, but overall, I don't have a problem with it.
Van Buge says they're seeing more nursing students opting to become NPs, and they could soon be a driving force in healthcare throughout the Valley.
Physicians say Nevada has a history of being what they call under-doctored. They believe nurse practitioners will be on the rise in some of our outlying areas where doctors are even more difficult to find. Paula?
I have a great nurse practitioner. Thanks for that story, Lauren.